Hello, hey guys. I hope that you are all doing well. Now we are still on the topic of mental health, specifically discussing matters depression and anxiety disorders. Now, these are very serious conditions for any human being. In fact, I would say severe depression, severe anxiety disorder is one of the worst conditions any human being can suffer from. It is debilitating. It puts you down. It takes away your ability to communicate. It takes away your confidence. And the worst part of it is that when you show up at the workplace, when you show up at church, when you show up in whatever setting that you often go to, you appear whole. You appear whole. People see you, they see that you are whole. And they have the same expectations of you as they have of any adult who is in good mental health. The reality, however, is that you are not whole. That on the inside you are broken. On the inside you are empty. In fact, if you can allow me, I can say that on the inside it feels like you are still a small child. So it's a serious condition. And at the workplace, you are likely to suffer bullying because you show up, the way you communicate, the way you appear, you may actually look funny sometimes. When people expect you to do certain things, you can't do them the way it is expected of you. So some colleagues, especially those who are not sensitive, might bully you. And bullying worsens depression. So it is very important that when you sense that you are suffering from depression, that you have this prolonged, unexplained sense of sadness, that on the inside you feel very sad and very painful. When you notice that you are becoming increasingly lonely because people rarely want to hang around depressed people. It takes someone with great understanding and someone who maybe has gone through a similar situation to understand you and stay close to you. In many instances, depressed people are alone. Even their family members tend to keep away from them. We live in a very capitalistic society, a society where the strongest gets what they want, the weakest fall by the wayside, and people move on and forget about them. The same will happen for you in the workplace. You may hope that someone will understand, but you will be very fortunate to have a boss or colleagues who will stand by you, who will understand you, who will help you to seek help until you fully recover as you keep your job. Many of them will find a way to ease you out so that you stop being a problem to them. So this being the situation, it is important that you seek help. Now, where do you seek help? When you have depression, when you have anxiety attacks, when you don't get sufficient sleep at night, Where do you go for help? The first point of call would be to talk to someone that you trust completely. Could be a family member, could be somebody in your church, could be a colleague. You just need to be careful that it will be someone who will not judge you, be someone who will listen to you, someone who will empathize, someone who will not just listen to you to give you a solution, but to tell you about their problems as well, so that you can realize that, oh, I'm not the only one who is suffering, but with somebody who will give you a shoulder to lean on, somebody who will know, who will say, I don't know how you feel, but I am here for you, and I want you to seek help. Having such a person is gold. Unfortunately, not everyone has got such a person. The second step is you may need to see a therapist or a clinical psychologist. Now, a therapist or a clinical psychologist is someone who is trained on matters of the mind, how human beings think, and they may lead you in conversations that eventually help you to get to know the challenge that you are facing. And getting to know the challenge that you are facing, from there, you can get to a point where you start to obtain healing. This is especially so for depression and anxiety attacks that result from certain situations. Maybe you have suffered a loss. Maybe the business has gone down. Maybe you have lost a job. There are certain situations which can make people to sink into depression. And this one's by talking to a therapist or even talking to a close friend and having somebody who can stand by you, having meetings with a clinical psychologist, walking you through the situation, getting to a point where you get to believe, well, this has happened and I have what it takes to move on to the next level. That can be enough to help you. Now, there are certain types of depression that do not result from known situations. No one knows how it came about. Some of them, I understand from my doctor, run in families. So you may find that your grandmother or your grandfather or your dad or somebody in the family might have suffered from the same condition and it's been passed on to you. Now, these are not the kind of depression that merely talking to someone can help you. Here, you need a psychiatrist. A psychiatrist who will be able to assess your situation and prescribe the right medication. There are medication that can help to correct the chemical imbalance in the brain. There are drugs which can help to lift your moods and over time can give you complete relief. I'm not a medical doctor, so that's so much I can say, but I can say that there are those types of depression that require intervention by a trained psychiatrist, not a clinical psychologist. Where are some of the places you can go when you need to see a psychiatrist? Psychiatrists are available in Kenya. thankfully. There are not as many as we would expect. They are not as affordable as we would want, but they are available. And if some of them have got their own clinics in some of the towns, Nairobi, Mombasa, Kisumu, Nakuru, some of the major towns, you may find a good psychiatrist who can listen to you and walk the journey with you. If you go to some of the hospitals, you'll find that they have a psychiatrist who comes once in a while. I know one of the hospitals I go to right now, the psychiatrist comes once a week, usually on Saturday. So that's the day when I go to visit him. They can be pricey. It can cost you quite some money. But thankfully, some of the public hospitals also have good psychiatrists. And I'm grateful that the government of Kenya, a few years ago, took matters of depression, matters of mental health, matters of alcoholism very seriously. And even there was a declaration that a person who is into alcoholism would not be fired from their job. Instead, they would be helped. They would be helped to find recovery. That's a major policy direction for the country, for which we must be grateful. But just about a week ago, I walked into what is known as the Mathare Mental Hospital. I went there to see what kind of services they offer and if I can get any help. And let me tell you that I got to that place. It's a vast place and there were so many people seeking help. And I paid Kenya shillings 200 at the reception, and from then on I waited. The only problem was waiting for many hours because people are many and there's only one doctor, but I was patient. I waited until the doctor was ready to see me, and he saw me. And he offered me good care and good counsel, and even prescribed a specific drug which had not been prescribed by the doctor I've been seeing before. And that drug is having a good outcome. And I expect to see that doctor again in 1 month's time. So do not be afraid to walk into a place like Mathare, walking into Mathare Mental Health Hospital. Actually, I think the name changed. Now it is just Mathare Hospital. Does not mean that there's something wrong with you. Mental health, as I say, is a condition like any other. It's a disease like any other, which deserves to get proper diagnosis and proper intervention and proper treatment. We should all get together and fight until everyone gets to understand that mental health matters. That mental health is not different from any other condition, and no one should be stigmatized for having a mental health condition. God bless you. Till we meet again on this channel. Remember to follow me. I am Fred Gorey. Goodbye.